It is time for your health check, and today is National Wear Red Day, which is why we're all wearing red today. And the idea really is to bring attention and awareness to heart health. I want to share some statistics with you. Look at these. These are from the American Heart Association. Cardiovascular disease, the #1 killer of women in the U.S. And no, this is not an old lady problem. Heart disease and stroke can happen at any time. In fact, 45% of women ages 20 and up are living with some form of heart disease. I want to bring in Dr. Brandy Williams, cardiologist, Texas Health Fort Worth. Thank you so much for joining me this morning. Dr. Williams, can you explain what is heart disease for people who don't really understand?
Thank you for having me. Heart disease is really any disorder that affects the heart. But one of the more common ones is coronary artery disease or atherosclerosis. Atherosclerosis is plaque that builds up in the arteries around the heart and can block the flow of blood to the heart muscle.
And so are you born with heart disease, or do actions, patterns, habits create it over time? How does this happen?
Well, definitely genetics play some role, but our actions play the most role, such as smoking, bad diet, not exercising, and chronic stress on the body. All of those can help build up plaque over time.
I know that 80% of heart disease is preventable. And so, of course, I always talk about good nutrition, diet, et cetera, especially now in this, age of the pandemic and as we're fighting COVID-19 as well.
Definitely. So, having exercise, stress management, a good diet are all super important. Obviously, with the COVID-19, everyone gets scared to get checked out. So if you're having signs and symptoms of a heart attack, we really encourage you to seek help. What I like to tell my patients is time is muscle. And if you don't get there quick enough, then you may lose muscle to your heart or damage that muscle.
That's a good reminder. Dr. Williams, thank you so much. You guys can learn more at wearredday.org. And Greg, if you were wondering what this says, this is from the American Heart Association from years ago. It's life is why. And on the mornings it says, or on the back it says mornings are why. Right. Why do we wear red? For our life.
There you go. Very good. Very good. Because yes, we were wondering that. So I'm glad you let us know what that said. You gave us a big hint earlier.